Hi, I'm Dr. Charles Newby, and today we're going to talk to you about spinal decompression. I've been practicing in Iron River, Michigan for about 30 years, and within the last year and a half, we've brought in spinal decompression to the Iron River area. I think it's a great asset for the area because I think I'm the only chiropractor within like 50 to 100 miles that is actually doing the spinal decompression. And the reason why we brought in spinal decompression is there's a lot of problems out there, such as disc problems, degenerative problems going on in the spine, that are being worked with, at a medical level. But the problem we're finding is a lot of times the problem is just being managed by pain and by pain relief, usually through drugs, maybe surgery, and also maybe like pain injections. So what is really spinal decompression? Well, spinal decompression is a special table, as you can see right here. We call this the ADP 400, and it is programmed by a computer. Our patient can get spinal decompression either in the neck region, or we'll show you in a second how they turn around and get spinal decompression in the lower back. And the way spinal decompression works, and we'll first determine what we'll use it for. In a lot of cases, we may use it for a bulging disc or a herniated disc. Now, a lot of times that term is used interchangeably. A bulging disc means that the disc has been torn, it's bulging out into the nerve canal or spinal canal, and it's actually pinching a nerve. Now, when it pinches that nerve, that pain can run down the leg, like sciatica, or you might just get back spasm or a lot of other pain around the spine. So the difference between spinal decompression and traction is quite a bit different. When normally you get into traction, they hook you up like you would see like this, set the amount of pounds that they're going to pull on the neck or on the spine, and start to traction and pull apart that spine. Now, the problem occurring there, what happens when the traction is performed too quickly, your body's going to react to that. The muscles around the spine may fire, they may spasm, they may tighten up. So you're not going to get the benefit of that spine or that disc being pulled apart nice and gently and gradually to start correcting the problem. The difference between traction and spinal decompression is very slowly and gently. And over here, if we look at the computer, you see like a little stair-step pyramid going on there. And basically, we first set the pounds for what we want to do the decompression on for the neck. So, for instance, if we want to set that for 15 pounds, that's going to take several minutes to work itself up to 15 pounds. So the first time that the machine starts to pull the disc apart, it's going to do that very gently at only a few pounds. And it's going to hold that gentle pull, let's say at 5 pounds, for about 30 seconds, and then rest for 10 seconds. Now when it pulls again, it may move up a little more to maybe 8 pounds for 30 seconds and rest for 10 seconds. That very subtly starts to pull the spine apart, does not fire these muscles that surround the spine, and it starts to create a vacuum. What the vacuum does then, if the disc is displaced or bulged on the nerve, that negative pressure, because sometimes when this disc is a problem, there's too much pressure there than there should be, it creates a negative pressure, and it starts to draw and work like a vacuum. It starts to pull that disc back in place, back in the center. It also brings a new blood supply in there, and because of the pumping action, it starts to move a lot of that swelling and fluid out of there. So we've had numerous patients on spinal decompression. Our oldest patient has probably been about 93. Very gentle procedure. We've had very severe low back disc herniations that we've corrected with spinal decompression. The other thing that we can help the spine with spinal decompression is if a disc has lost its space, if it's been into what we call disc degeneration, where the disc is very thin, there's hardly no blood supply, the openings where the nerves come through are very small, and the nerves are being pinched. So the spinal decompression will also open and close that disc space and bring some good blood supply back into that, and actually start to help create some disc regeneration. Now, are you a candidate for spinal decompression? This is where, if you come into the office, we'll do an evaluation. Sometimes we'll have you bring your MRI in, your x-rays. We'll look at your specific situation. If you're a candidate and you have specific problems in the spine, like disc herniation or disc degeneration, chances are spinal decompression will help you. There's around an 85 to 90% result rate. In addition to providing the spinal decompression, we always enhance the person's ability to heal faster with compressed oxygen, concentrated oxygen, which we deliver here from our oxygen concentrators. We find that if we can feed that nervous system, give it the fuel it needs, the oxygen, that'll deliver a much quicker result, and a result that we hopefully will expect to be good. So the enhanced oxygen gives us some cutting edge additions to our spinal decompression. As you can see here, as opposed to the cervical or neck decompression, we now have our patient here in the position for a lower back or lumbar decompression. So basically the decompression machine works the same way, and we have our patient's harnessed in at the top here so his body won't move, and we have the harness down here in the bottom. What the computer, as it starts to pull, it will pull very gentle, and as you can see, the table will move as his spine is pulled apart, or as we open up those discs. And as that relaxes, the table will come together like that. So this goes through a period of about 20 minutes, and it will create that vacuum process like we talked about. It'll pull that disc back in alignment and bring that new circulation back into the disc like we want. So we've had many success stories. If you want to look up on our website, we'll also include a testimonial video on this video here. Some of our successful patients have had some pretty severe problems and avoided surgery. And if you want to check out our website at www.newbydc.com, or our number is 906-265-5175. Please call us. We're going to offer you a consultation and pre-consultation to see if you are a candidate, for spinal decompression. And if you want to email us too, it's newbydc@yahoo.com. So thank you for viewing this DVD on spinal decompression. We're looking forward to helping you and giving us a chance. Certainly try this before you think about surgery or pain medication or any different types of pain injections. This is always the first place to start. So thank you very much.